Gallbladder cancer, the invisible killer. The gallbladder cancer, often called the silent killer, is a relatively rare but highly lethal cancer that affects the digestive system. Gallbladder cancer is called the silent killer because it is often not detected until the late stages, making early diagnosis and treatment extremely challenging. In many cases, the initial symptoms of gallbladder cancer are subtle and can easily be mistaken for minor gastrointestinal problems, such as indigestion, bloating, or nausea. Anatomy and function of the gallbladder. The gallbladder is a small, pear-shaped organ located below the liver on the right side of the abdomen. The gallbladder is about 3 to 4 inches long and has a capacity of about 30 to 50 milliliters. Despite its small size, the gallbladder plays a vital role in the digestive system. It acts as a reservoir for bile, a digestive fluid produced by the liver. The main function of the gallbladder is to store and concentrate bile between meals. When food enters the small intestine, especially greasy food, the gallbladder contracts and releases bile into the common bile duct, which then carries it to the duodenum. This process aids in the digestion of fats, making them more easily absorbed by the body. While the role of the gallbladder is important, it is not essential. Many people can live healthy lives without a gallbladder because the liver continues to produce bile, which can flow directly into the small intestine, albeit in a lower concentration. Common gallbladder disorders. Several conditions can affect the gallbladder, some of which may increase your risk of gallbladder cancer. Gallstones. Gallstones are solid particles that form in the gallbladder, usually made of cholesterol or bilirubin. They vary in size and can cause blockage of the bile duct, which can lead to pain, inflammation, and infection. Chronic irritation from gallstones is a significant risk factor for gallbladder cancer. Cholecystitis. This disease is an inflammation of the gallbladder, usually caused by a gallstone blocking the cystic duct. Acute cholecystitis causes severe abdominal pain, fever, and vomiting, while chronic cholecystitis causes the gallbladder wall to thicken and eventually scar. Common bile duct stones. Gallstones migrate from the gallbladder into the common bile duct, causing a blockage that can lead to infections such as cholangitis or pancreatitis. Gallbladder polyps. These are growths that protrude from the lining of the gallbladder. While most polyps are benign, some types can develop into cancer. Large polyps, especially those larger than 1 centimeter, are more likely to be malignant. Chronic cholecystitis and gallstones. One of the most important risk factors for gallbladder cancer is chronic inflammation of the gallbladder, often caused by gallstones. Gallstones irritate the gallbladder lining, leading to chronic inflammation and an increased risk of malignant transformation. People with a history of chronic cholecystitis or common bile duct stones have a higher risk of gallbladder cancer. Large or multiple gallstones and a porcelain white gallbladder further increase this risk. Definition and types of gallbladder cancer. Gallbladder cancer is a malignant tumor that begins in the gallbladder. Gallbladder cancer can begin in different types of cells in the gallbladder. The most common type is adenocarcinoma, which begins in the glandular cells in the gallbladder lining. These cells produce mucus and other fluids, and when they change to a malignant form, they form a tumor. The exact cause of gallbladder cancer is unknown, but it is believed to be caused by a combination of genetic mutations and chronic inflammation. The process often begins with the development of precancerous changes in the gallbladder lining, such as dysplasia or metaplasia. Over time, these abnormal cells may accumulate further mutations, leading to the formation of a malignant tumor. Gallbladder cancer grows and spreads rapidly. It can invade nearby structures, such as the liver, bile ducts, and small intestine, and may also metastasize to distant organs, such as the lungs or bones. The fact that the cancer spreads so quickly is one reason it has a poor prognosis. Symptoms and early signs. One of the biggest challenges in diagnosing gallbladder cancer is that its early symptoms are not obvious. These symptoms are often mistaken for more common and less serious gastrointestinal problems, leading to delayed diagnosis. In the early stages, gallbladder cancer often presents with subtle symptoms that are easily attributed to less serious conditions, such as indigestion or gastroesophageal reflux disease. The pain is often described as a dull ache in the right upper quadrant of the abdomen that may be intermittent and can sometimes be mistaken for gallstones or other biliary conditions. These symptoms are common in many gastrointestinal conditions and can be particularly misleading when they occur in gallbladder cancer. Patients may experience feelings of fullness, bloating, or excessive gas after eating, which can easily be mistaken for dietary intolerance or indigestion. Unexplained, gradual weight loss may occur, but this is often overlooked in the early stages. These early symptoms, while worrisome, are not specific to gallbladder cancer and are usually not serious enough to warrant immediate medical attention. As a result, many cases of gallbladder cancer are not diagnosed until the disease has advanced. As gallbladder cancer progresses, symptoms become more pronounced and disease-specific. Stage 1. The cancer is confined to the lining of the gallbladder, and symptoms are usually mild or similar to those of common gallbladder disease. Stage 2. As the cancer invades deeper into the gallbladder, patients may experience more persistent pain in the right upper abdomen, jaundice, and dark urine. These symptoms suggest that the bile duct may be affected. Stage 3. At this stage, the cancer has spread to nearby structures, such as the liver or bile ducts. Symptoms may include persistent jaundice, severe abdominal pain, itching, and a palpable mass in the abdomen. Stage 4. When the cancer spreads to distant organs, patients may experience more systemic symptoms, such as fatigue, significant weight loss, fever, and signs of organ failure. They may also develop ascites and difficulty breathing due to metastasis to the liver or lungs. Given the challenges of early detection, the diagnosis of gallbladder cancer usually involves a combination of imaging tests, blood tests, and tissue biopsies. These diagnostic procedures are designed to confirm the presence of the cancer, determine its stage, and guide treatment plans. Ultrasound. It is often the first imaging test performed when gallbladder disease is suspected. It can detect gallstones, thickening of the gallbladder wall, and tumors. However, ultrasound may not be enough to determine how far the cancer has spread. CT scans provides detailed cross-sectional images of the abdomen that can assess tumor size, invasion of nearby organs, and lymph node involvement or metastasis. MRI and pancreaticobiliary pancreatography are particularly useful for viewing the bile ducts and detecting any obstructions or tumors. It can provide more detailed images than a CT scans, especially for soft tissue differentiation. ERCP, a procedure that combines endoscopy and fluoroscopy to view the bile ducts. It is used both for diagnosis and for therapeutic interventions, such as placing a stent to relieve a bile duct obstruction. PET scan, sometimes used to detect metastasis or to differentiate between benign and malignant lesions. Treatment for gallbladder cancer depends on the stage of the disease at diagnosis, the patient's overall health, and other personal factors. Treatment options include surgery, chemotherapy, radiation therapy, and in some cases, targeted therapy and immunotherapy.